So today we're going to be talking particularly about this little device, which is a small solution to a big problem.
Very big problem.
So Dr. Schwartz, tell us about this night shift.
Well, several years ago when sleep apnea began to be discovered, we found that there was a lot of patients who were experiencing sleep apnea specifically when they were on their backs. Over 70% of obstructive sleep apnea patients tend to have sleep apnea predominantly in the supine position. And I brought my little training aid to just show a little bit about that.
We could show that.
And that is that when someone is on their back in the supine position, their airway tends to be compromised by the tongue and the muscles of the throat collapsing and falling backwards, as is demonstrated by my little friend here. So the main treatment for sleep apnea right now would be CPAP or PAP therapy, positive airway pressure. What we find is that for some patients that is just not enough, and a lot of patients are not compliant with it. So we've introduced some other modalities to complement CPAP therapy. One of them is the use of oral appliances, which I can talk about in a little bit. But one of the newer and innovative appliance treatments is this. It's night shift by advanced brain monitoring. And it's a small supine position monitor that allows us to place it on your neck, or the patient will place it on their neck at night, just like this. And there's a small battery, rechargeable battery, so they place it on their neck, fits comfortably. They turn it on, and when they are on their back, the monitor actually starts to vibrate and increase the frequency of the vibration until the patient rolls back onto their side.
This has to be in the back, right?
So that part would be on the back. They'd push the button and allow themselves to fall asleep.
It's pretty comfortable.
It's made out of a very thin elastic material.
You can use this in place of the CPAP or in addition to
CPAP therapy is the gold standard by which we monitor everything else. It is meant to be used in conjunction with CPAP and in conjunction with oral appliances. We find that not only does position play a role in the effectiveness of treatment of apnea, but also the mandibular position and the position of the tongue. So with appliances such as these, we can actually place these into the mouth, both in this case on the top and the bottom. The lower jaw is brought forward, as is demonstrated here, and it opens up the airway by pulling on muscles that are part of the back of the airway, the tongue, what we call the pharyngeal constrictor muscles. And these are the same muscles that when gravity is compromising the airway by sleep position, we find that we can improve those muscles' tone and position with specific devices.
Doc, so there's a lack of air that's taking place for a number of reasons that are moving around, and you're trying to get them in a position where they can just breathe on their own with an apparatus or in their position.
Correct. Okay. Correct. So what we found in long-term studies is that using either the oral appliances or the night shift, we can increase. So there's a very strong symbiotic relationship between not only the body position but also either mandibular advancement with an appliance or with the CPAP machine by using positive airway pressure to open up the airway.
Now, I had asked about pacemaker patients using this, and there shouldn't be any problems, except they said sometimes the battery will make a noise and they will think that their battery's going out.
For some patients, they have a warning system on their pacemakers. This makes a little vibration noise, and so it's possible that the patient who may not be as understanding the intricacies of this might confuse that noise with their pacemaker battery. So it's important that when we set the patients up and send them home with these, that they understand what the noises are and what they should be looking and listening for.
Mm-hmm. So have you ever experienced this or tried this?
I have. I have used it on several occasions. And what's beautiful for the patient and the practitioner who might be prescribing it is that it allows us to actually download data. And we can actually see the patient's sleep. So whether they're asleep and whether they're awake, we can see there's a little snoring recorder in here as well. So it will record sound levels of certain decibels. And you can see in a graphic form the improvement when the patient is on their side versus when they're on their back. So it's a wonderful way for the patient to train themselves. And it is meant to be used continuously. So the patient would use this as any other nighttime training device. There are the old model was doctors would tell patients to sew tennis balls into their into a sock and pin that to their shirt, so that then when they slept on their back, they would be forced over to their side. A highly ineffective and crude type of a treatment. There are some pillows that patients can buy on the internet that will also try to keep them on their sides. We'll see these with patients women who are pregnant, those long body pillows to help keep them on their side as well. This happens to be one of the newest novel approaches to that, and it's quite comfortable. I've had several patients who've used this on a regular basis as a way of increasing their effectiveness of treatment, whether it's the CPAP or the oral device.
So during that 8-hour, well, let's say 6 or 7 hours sleep period, that none of us get 8, but during that whole time period, sequentially, it monitors every few minutes or all the way through?
It's continually monitoring, and it will store data for up to, I believe it's up to a month.
Wow.
So you can download that on a regular computer, and it will give you a graphic interface to see the attempts that the patient was on there, trying to go on their back, the successful times that when they were on their side, the snoring level decreases. So it's a very user-friendly type of machine that can be used.
Okay, we've only got like 2.5 minutes left. So I want to talk again about this night shift, which is a nice little device. I guess can be used alone or in conjunction with your other machinery that you have for
Correct.
snoring. So what haven't I asked you that you can think of?
Where to find it? I think that you can actually call the company, Advanced Brain Monitoring, night shift. If you do a Google search under night shift, you'll be able to find that. I'm sure you'll have some information available. And there are providers around the country that have supported this product and that use it on a regular basis. And
where are you at, in case people want to call about you?
I am located at 680 Lakeshore Drive in Chicago at the Center for Sleep Medicine. And then my private office is in Skokie. That's in 9933 Lawler. I think we have the card available, the number. So either in Skokie or in Chicago.
And spell your name.
S-C-H-W-A-R-T-Z, Schwartz.
Okay. And your first name is?
David.
David. So you get the right Schwartz.